We are joined by a special guest. We have Megan Martin. She is the Director of Clinical Genetic Services at Lineagen. And as Director of Clinical Genetic Services, she leads Lineagen's genetic counseling and cytogenetics team. And under her leadership, the clinical services team provides physicians and families with consultation, education, and support throughout the genetic testing and evaluation process. Megan is licensed and certified genetic counselor, has been with Lineagen in Salt Lake City, Utah for 6 years. Welcome to the show, Megan.
Thank you for having me.
Good to have you here. And let's start with, why is genetic testing important for people with ASD if they already have a diagnosis?
Yeah, that's a great question, and actually one of the common questions we receive from many families and physicians. And when a person receives a diagnosis of autism, that's really only describing the symptoms that are being observed in that individual. It doesn't get down to the question of, why are these symptoms present? What is the cause? And so a genetic diagnosis can help provide basically like a roadmap to say, okay, if we have a better understanding of what the genetic condition is that's relating or causing the symptoms of autism in this individual, what can we do to provide better care? An analogy for this is like if you have a sore throat and go to a doctor, that doctor is going to look at kind of the cause of why do you have that sore throat, because that's going to impact their treatment plan for you. So similarly, with a genetic diagnosis, you can have a better kind of understanding of what treatment, therapies, kind of approach to the medical care may be better for that individual versus others, individual without that genetic condition. And genetic testing has actually become more and more common in individuals with autism, and recent studies have shown that up to 26% of people with autism spectrum disorder do have an underlying genetic change that are related to those symptoms that we're seeing in that individual.
Well, and Megan, you mentioned that sometimes it can change what happens with the treatment. Can you give us an example of how it does change the treatment?
Yeah. So I kind of like to think of a genetic diagnosis, again, as providing a roadmap. It's not a crystal ball. None of us have a crystal ball of what we're going to anticipate for our life. But let's say we have a genetic diagnosis and we identify it in an individual. We can actually look and say, how have other children grown and developed with that same condition? What medical risks are they potentially at higher risk for than the general population? Are there any medical complications that we should have on our radar? Sometimes there's different therapeutic approaches that may be more effective. And also this information can be really helpful for families who have questions about, is this going to happen again? What is the chance for this to happen again? A genetic diagnosis can provide insight into those types of questions. And actually, I think it's best kind of demonstrated through a case study, a case that we actually recently had here at Lineagen. And I counseled this family who had a 5-year-old daughter who had delayed milestones. So she wasn't meeting her milestones. She did have a diagnosis of autism spectrum disorder, but the family really didn't feel like that completely described what was going on. It wasn't a very good fit for her. She had particular difficulties in expressive language skills and was undergoing pretty extensive speech therapy, and unfortunately wasn't really making much progress in that area. And she was entering kindergarten, and the family had big questions about, what do we do from here? How do we provide the best environment, educational environment, therapeutic environment, and medical approach for them? So this individual's pediatrician noticed, these symptoms, autism, and these questions that this family had, and ordered a particular genetic test called Chromosomal Microarray, and it looks at changes in the chromosomes, particularly missing or extra pieces of those chromosomes. So this test was done for this little girl, and lo and behold, we find that she has an extra piece of chromosome 15. And this particular genetic change causes a condition called Dup15q syndrome. So now knowing this, we can look and say, okay, well, what is the experience of those individuals with this specific genetic syndrome, and how have they, kind of encountered medical challenges? We realized that individuals with this particular syndrome have a high risk for seizures, usually in early childhood. Now, she didn't have any signs of seizures, but knowing this diagnosis got her into an immediate evaluation with a neurologist to look for maybe unrecognized signs of seizure activity. Additionally, with this particular condition, unfortunately, these individuals just don't often obtain very much speech. And so knowing this, there's been a lot of great advances in the therapeutic approach that families have learned with alternative methods such as picture exchange or sign language that has been particularly effective with encouraging that communication. Okay. So now knowing all this information, this family can take this information to their medical providers, to their therapists, and also actually include this information in the IEP to provide an overall specialized care plan for this.
Great. So it can help families develop a treatment plan. Now, there are different types of genetic testing available. How does it compare to testing for medication management?
Yeah. We can look at our genetics in many different ways, and the particular type of genetic test that is selected depends upon the question that you're hoping to answer. So as an example, there is a genetic test, we call it Pharmacogenomic Testing, and what that does is it looks at common genetic changes in individuals. We all have these genetic changes, and it actually impacts how our body responds to certain medications. So knowing this information, it can actually help us with dosing and selection of medications that may be more effective for that individual. Now, conversely, we do also offer another genetic test called the Chromosomal Microarray. Again, that looks at deletion and duplications, so missing or extra pieces of the genetic material, and that's more of a diagnostic genetic test. We're looking at the underlying reason of why we are seeing these symptoms in this individual. And those deletion and duplication syndromes can be one of the most common causes, genetic causes, of autism that we see.
And Megan, I'm sure a lot of people are wondering as they're watching this, is this something that they have to pay for out of pocket, or is this covered by insurance?
Yeah. Many of the genetic tests are currently included in medical guidelines. So professional medical organizations and associations have issued statements to, who are candidates and when to use this type of testing. And because of that, many insurers do cover this testing because it is in the guidelines.
Wonderful.
Yeah.
Wonderful.
So how do families learn more and about having their child tested? Where can they learn more?
Yeah, we actually have a website that families can go to. But first, this is a genetic test. All of our genetic tests do have to be ordered by a medical provider. And we feel very strongly about assisting families in that process of getting their doctor to order this testing and have access to this testing. So if you are interested in this testing, you can go ahead and go online, Lineagen.com, and you'll see on the first page, I'm a parent. Click on that. It'll take you to a new page and click on sign up for testing. So that will take you to an information sheet that you can fill out, learn more information, and kind of see the next steps of where to go from there.
Wonderful. We have that up on our screen right now, Lineagen.com. We just had that up on our screen, Lineagen.com. All right. All right. Thank you. This is very valuable information, and we encourage parents interested to go to the website and check it out.
Thank you so much, Megan.
Thank you, Megan. Good to see you.
And give our love to everybody at Lineagen.
Yes.